Hi everyone, I'm Danielle Matias at Caring Medical Florida, talking today about resolving thumb pain. Most people that complain of thumb pain kind of do this, or they complain about it maybe more so at the base of the thumb where it meets the wrist. Very, very common. That we, for short, call the CMC joint, and then up here we've got what's called the MCP joint. In my practice, I see a lot of this, and I see a lot of it actually happening in younger and younger people. Cell phones, I think, are actually a big culprit of that. Not that we all don't do things with our hands and overuse our thumbs in other ways, but it's very, very common. It's often called text thumb, where you get a lot of pain in your thumb just from being on your cell phone for too long and repeatedly doing these kind of micro motions. So, I mean, texting on your thumb is not a big force on your thumb, right? But you do it, a million times a week or however long. Over time, you can actually get overuse injuries in your thumb. Majority of the time, we'll see people that have that pain at that CMC joint at the base of the thumb. Not that they couldn't have it here at that MCP joint, but a lot of times when we see pain, patients that have pain there, that might actually be more related to a trauma. And they talk about skier's thumb a lot, like you feel skiing, maybe hurt some of the ligaments there. Fluke things that happen where you're walking, your thumb gets caught, and you keep walking and it kind of jars your thumb. That might be more in this MCP area. This is actually just an example UCL injury where this ligament becomes torn or becomes stretched out. Things like this where the ligament actually gets torn, we do refer patients to surgery for that. I've had to do that when people come in with these crazy injuries. However, majority of the time when we see people, the ligament is intact, it's just loose, it's just injured, and we talk about doing prolotherapy to stabilize the area and restore function and restore stability. Over time, when people have ligament injuries, those injuries tend not to heal back to 100%. And that doesn't matter how old you are. People ask that a lot about age and healing, but just in general, those ligament injuries oftentimes do not heal back to 100%. So what happens is, let's say, hypothetically, you injure your thumb, you stretch out all the ligaments, and your body tries to heal itself, and you heal back to 85%. I'm just throwing numbers out there. Well, maybe you can function on that, right? You're like, oh, I'm not, somebody that does a lot of work with my hands, or I do some computer work, I'm on my phone, but, otherwise I manage okay. Well, let's say then you injure it again, okay? Something else happens, you sprain your thumb. Well, now maybe you're healed back to 75%. Again, I'm just making up numbers. What happens, over time is that you don't have strong tissues, so then you can re-injure it, re-aggravate it, doing things, and then eventually it becomes a point where you're like, wow, shoot, this used to just bother me with X, Y, or Z activities, and now it's starting to bother me when I'm cooking, and now it's starting to bother me when I do my hair and brush my teeth, and now it's starting to bother me all the time, even just at rest. That's a very common progression of their chronic pain. As these soft tissue, these ligament and even tendon injuries don't heal, they throw off the joint dynamics, right? So if your ligaments are supposed to hold your bones really tight and they're stretched out and those bones are moving more than they should, well, over time, gradually, they can start to wear down cartilage and wear down that surrounding tissue. That is actually what leads to arthritis. So that's actually when people come into the office with thumb arthritis and they're like, how did this happen? That's what happens. And so this is just actually how we can see just on x-ray thumb arthritis. So nice, really smooth, bony margins, right? That bone just looks so smooth. In between the joint here looks so nice. And over here, this is like this. So this is the base of the thumb. It looks kind of muddled. It's not a medical term, but I just say, it just kind of looks muddled. It's not as clean. You've got these bone spurs, excess bone, as that bone has just been kind of worn down over time. Aside from x-ray and even ultrasound imaging, some physical exam things that we'll do, just to see, you can even do this at home, just to see if your thumb actually is unstable, is we call this a grind test. So what you do is you'll put, kind of put your hand here and then kind of move your thumb. If you feel or hear grinding, popping, that is actually a sign of joint instability in your thumb. This and x-rays help us determine are patients good prolotherapy candidates. Do we think that they would respond well to regenerative medicine to heal the ligament injuries, restabilize the joint, and then of course reduce pain and increase function? Sometimes we do have to brace people because, again, we see chronic cases in this office. They may have already even tried a brace. You're like, hey, I did a brace, I did physical therapy. I feel better on my brace, but it's not your cure, right? It's not going to fix anything. It's just going to make me feel better. But sometimes we'll use it for several reasons. One is if we're trying to stabilize areas, we might brace people when they're doing activities that would otherwise maybe put that joint in an unstable position, right? Let's say somebody likes to garden a lot, or they do a ton of housework where they're using their hands. We might want them to brace it when they're doing that just to protect the healing and, to be honest, act as a reminder not to overdo it, right? This is actually just a little example on where we would do injections for somebody that has the CMC or base of their thumb pain. All of those ligament attachments trying to rebuild the joint. This is a study done on 17 thumbs, so on 13 people with CMC joint arthritis. Okay, so this is a visual analog scale. So the blue is before. So this is their pain at rest, pain with activities, with exercising, amount of stiffness, limitations in range of motion, and then level of that crunching crepitation sound. So this is before prolotherapy treatments, and then the red is after. So you can see actually just across the board, significant reductions in pain level, not only just at rest, but even with exercising. So the ability to do the things that you want to do, right? Like stay active, normal activities of daily living, stiffness, range of motion, and so forth. This is another group of patients, same scale, this visual analog scale for amount of pain at rest, pain with movement, and then pain with gripping something. I always say hold on to a coffee cup because it's so important. But this is with patients that were treated with dextrose versus those that were treated with a placebo. Much significant, or more significant, I should say, improvement in those with dextrose prolotherapy. I hope this video was informative. If you have any questions about it, please feel free to reach out to us. Thanks for watching.